Hi, this is Dr. Jerry Goldhaber, the Warnings Doctor, and I want to welcome you to another episode of my podcast, Exposed, an exclusive look behind the curtain of corporate greed. Today's episode, I wanted to throw it open to you, my listeners, for your questions about what's on your mind today, particularly with regards to the COVID crisis that we're all facing. And I've selected from the hundreds of questions the Warnings Doctor has gotten over the last few days, the most common questions you have, the ones you most often have at the top of your mind. So let's start. First question I get, Doctor, what's the story with masks? I hear people telling me, don't wear it, wear it, what kind of mask works? All right, let's put aside all the politics, my friends. Wear your mask. Some people are calling them face coverings because they don't think it sounds as masculine. They call it a face covering. It doesn't imply a political statement. It's a mask. A mask will save your life and the life of somebody you love or a stranger you walk by on the street. Studies, the science is in. The Warnings Doctor is here to tell you there is no debate about this. You must wear a mask anytime you're outside of your home, your apartment, your residence, and keeping in mind social distance. But even if you don't think 6 feet or you'll be more than 6 feet apart, it's a good practice because some of the studies coming out right now, my friends, indicate that you could even be 10 feet or 12 feet away and still be exposed, particularly in certain settings that we're going to talk about when we address some of the other questions you have. So first and foremost, wear a mask wherever you go outside of your home, your apartment, your residence, whether you're going to work, you're going shopping, you're going for a walk on the beach, a walk on the streets. I ride my bike every day outside, weather permitting. I put a mask on when I'm on my bicycle. Over precaution will protect the Warnings Doctor from getting COVID, and I intend to keep that on. I wear a mask when I'm in an elevator. And as an aside, I won't allow anyone else in the elevator because I'm putting the mask on in case the person before me coughed COVID droplets into the elevator. I want some semblance of protection. I wear a mask as the Warnings Doctor to protect not just me, but to protect you. My health is your health, and your health is my health. And we have to wear masks, not as a political statement. I'm not wearing a mask, although I've been wearing a mask the last week in New York City that says vote on it. But a mask is not a political statement. It's not about who you want to vote for. Well, I take that back. It is about what you want to vote for. Safety. You want to vote for safety. So wear a mask. That's all I'll have to say about politics. Now you say to me, all right, I'm wearing a mask, but there's so many masks. There's so many different types of masks. Which kind of mask should I wear? Well, let me tell you that there are a lot of different styles. First and foremost, we have what's called the face covering mask, or a cloth mask. You just put the mask on, put it around your ears, and this will protect you. How safe is that? It'll probably increase the likelihood of you not being infected by about 20 or 30% improved safety. Now, you want to make that even better. Some cloth-covered masks have an opening on the back, and you can put a filter inside. Just a plain filter. You can pick these up online, Amazon. They're pretty standard. They're rectangles, and they fit into most masks. This is what a filter looks like, and it's just what it says. A filter will increase your safety in wearing a mask, protecting you from droplets. What's the percentage? Well, roughly right now, we believe it's close to 40 to 60% additional protection from just wearing a face covering alone. So this is the most common one. And if you're reluctant to put masks on because you think they don't make you look good, there's lots of designer masks. Watch Nancy Pelosi, if you will. She always matches her mask with her dress in her outfit. So you can make fashion statements out of it, or just do it because it's the right thing to do. Well, let's look at another kind of mask. This is a very common mask. It's called the surgical mask. It's this pale blue. Put it around your ears like that. That type of mask is readily available. The city of New York, where I live, they're giving these out for free all over the city. And this is the easiest mask to find. If you want to buy your own, they cost less than a penny a mask. You can get them online. And the surgical mask will give you a protection of probably in the vicinity of about 40 to 60%, the same as a cloth mask with a filter. Now, cloth mask without a filter, remember, won't be as protective. Now, the gold standard is what they call an N95. That's what doctors and nurses wear in hospitals. And this is what it looks like. It's an N95. It fits snugly. It's form-fitted, keeps the germs in, protects you from germs coming out. Probably 90 to 95% protection, meaning if you put this on, you personally will be protected from about 90 to 95% of COVID germs. Now, be careful. There's available readily in most hardware stores, Home Depot. This is another N95. This N95 mask is available for painting and industrial use. You'll notice it has a filter opening for breathing, exhaling oxygen and inhaling. This is not recommended for protection from COVID. This is probably because if you are asymptomatic or if you have COVID, you will exhale your droplets through the opening in this mask. So when I say an N95, I'm talking about the N95 mask that does not have the opening in it, the filtered opening in it. Those are the main masks. But again, my friends, the most important thing the warnings doctor can tell you, and the message I want to leave you with on this first question that listeners and viewers are asking me is, should I wear a mask? Yes. That case is closed. Yes, full stop, period. Wear your mask. You'll protect yourself, and more importantly, you'll protect other people. And that's what this is all about. Your safety, my safety, your health, my health. As cities are opening up around the United States, different degrees, some a little too fast for my taste as the warnings doctor, restaurants are opening up. Some restaurants are opening up as outdoor, and some are opening up indoor with certain restrictions on the number of people. In New York, it's 25% in certain areas, 50% in others if you're indoors. Outdoors, unlimited numbers because you're outdoors. Is it safe? What can I do? Should I eat out? Should I go and have fun? I was biking around the city yesterday on a Sunday, and what did I see? It's Sunday brunch. Lots of people outside. Inside, not so many. Indoors can be risky. Again, ventilation issues, social distancing issues. Masks have to be off when you're eating and drinking. What if you're coughing when you're eating or drinking and you're sitting within 10 feet of somebody else and they cough? It's just too risky for my good. I'm recommending avoid indoor restaurants until we're through this vaccine. Outdoor, a different story. I know that they're supposed to keep 6 feet apart in the tables and chairs, but I don't see that, but you're still outdoors. What's different, though, is that as the winter comes, and in this case in New York, the mayor has said we're going to allow outdoor to continue, a lot of restaurants are actually building wooden cabins on the streets and sidewalks of New York. And I'm looking at them, and with wooden floors, wooden sidewalls, and windows that are closed. And I'm saying, well, what's the difference between that being indoors? And they say, well, we have one side open. Well, the issue is ventilation. Where I grew up, physics taught me you need two openings opposite each other to have adequate ventilation. So I'd be very careful about an outdoor restaurant where you're practically sealed hermetically inside plastic tubing, wooden logs, and wooden floors. Be very careful because the issue is circulation. And if you have to put off this winter, and the restaurant industry is going to hate me for saying this, you may want to put off eating out in the winter if there's no circulation of air allowed. And I know it's going to be cold, so you have to juggle. Do I really want to eat out in cold circulating air, but safe from COVID, or do I want to wait, or do I want to take a chance on one less circulating of air, but more risk of COVID? These are personal choices. I don't recommend taking the unsafe options. You may want to put off eating in an outdoor restaurant in the winter if there's no option for adequate circulation. Well, those are the most often asked questions I have. There's another couple I want to just briefly cover with you. One is, and this is personal for me, I'm a swimmer. I train for triathlons, which involves running. I walk. It involves biking and swimming. And in fact, I was in training for a triathlon this last July, but it had to get postponed, obviously. And the pool I use is an indoor pool. It was closed. It just opened up. Here's the question. Should I go in it and do my lap swimming? I want to share it with you personally because I'll give you a spoiler alert. I chose no. And I chose no in consultation with my doctor. He said, Jerry, given your age and given that you have, I don't have asthma, but I have a possibility of asthma from living in Buffalo, New York, Buffalo Chamber, please don't hear that. For 34 years, you have a lot of cold, damp air, and it affects your pulmonary system. And I have to be very careful. He said that there's no problem with the water. Chlorinated water will kill your virus. There's not really much problem there. However, you have to go in and out of the pool. There could be air lingering in a humid, heated pool interior because you keep these pools indoors warm in the winter. So it's warm weather. Its humidity is very high in the pool area. And these are great conditions for virus to grow. And to stay in the air, if somebody coughed before you got in there, it could stay in there for hours at a time. And more importantly, if you have two lanes open, one for lap swimming in one direction and one the other, if there's two swimmers in the laps, they're going to pass each other at some point. Just the nature of swimming. And your mouth is opening, you're exhaling your droplets, and the same thing is true with the other person. So you could be exhaling droplets into each other's mouths every time you pass each other in the pool. Not exactly a safe thing to do. So for the most part, if you're younger, if you don't have any pre-existing conditions, and if there's only one lap lane open, I'd say go ahead, enjoy it. If there's two open, be careful in how you time your lap so you don't pass the other person and maybe look the other way. So then indoor swimming could be safe. I've chosen not to, but I have my own personal reasons that I've shared with you. The final question I wanted to bring up with you is, again, in the area of safety. This has to do with doctors. Should we go to the dentist? Should we go to the doctor? Should we get the procedures done? I had that same question. In June, I chickened out. I was supposed to go in for my quarterly dental cleaning. And I looked at the form they sent me to sign, and it scared me away. It said, I understand that there's aerosolization, possibly a virus in any dental situation, when they're cleaning your teeth. So I chickened out and I didn't go, and I missed one of my cleanings. This time around, I changed my mind because the dental practices are very safe. They let you take one person in at a time. I waited out in the street till they told me it was safe to come in. And I went right inside. The dentist and the hygienist were wearing 2 masks and a shield, protecting me from them. Obviously, I had to take my mask off when they were cleaning my teeth. But they did something that I hadn't noticed before. The dentist changed his means of cleaning my teeth from using that high-speed drill thing, the gnawing, sawing sound that scares us all. He didn't use that. He used the old-fashioned way, the pick and the stick thing, to clean my teeth. Why, he told me? Less aerosolization. So yes, don't postpone going to the dentist. I personally believe most dental practices are practicing American Dental Association COVID protocols, which is to limit people in no waiting rooms. People walk in and go right to the dentist. Dentists are protecting you from them and them from you. I think it's a safe thing to do. Do it. Same thing with doctors. I've gone and seen, I even had a colonoscopy during the COVID crisis. And I got a COVID test right before the colonoscopy. I went into the place where I was getting it, the doctor's office. I was the only patient, nobody in the waiting room. I went right in. Everybody was shielded and masked. Everything was sterilized, and it worked out fine. So yeah, definitely continue to see your doctors. Telemedicine and telehealth is going to be with us, and you should by all means use that if it's a minor thing. But if you need your blood taken, do it. If you need your teeth cleaned, do it. If you need a colonoscopy or a breast or a mammogram test, do it. Don't postpone what procedures that could save your life. So these are the most common questions I've been getting from my listeners and my viewers, and I intend to keep answering your questions as we move ahead through this crisis. My friends, we will get through the other side. I promise you, we will get through the other side. And a lot of what I say and talk about on the book and in the episodes on YouTube and in this episodes on podcasts, a lot of that information is based on what I've written about in my new book, Murder, Inc. Murder, Inc. How Unregulated Industry Kills or Injures Thousands of Americans every year and what you can do about it. Murder, Inc. is available right now in hardback, softback, paperback. It's available on Kindle. It's available everywhere you get your books, whether it's Amazon, Barnes & Noble. And good news, it's coming out in November in audiobook. That's right. If you want to take that bus ride or train ride to Boston or wherever to visit a family member, this would be a great audiobook for you to listen to. Murder, Inc. will be available on audiobook exclusively on Amazon, exclusively on iTunes, and exclusively on Audible. Those are the big three where most people get their audiobooks, and you'll find Murder, Inc. available on those three. And of course, again, you can follow this podcast and listen to our episodes of Exposed, an exclusive look behind the curtain of corporate greed. Until our next episode, my friends, I want to remind you again that the more informed you are, the safer you'll be.